Hello everyone, you're welcome to today's program. Today we'll be talking about weight loss surgery. I have a special guest on the program to discuss this topic, and her name is Dr. Funmilayo Shoneye. Dr. Shoneye, you're welcome to the program.
Thank you very much.
It's so nice to have you here.
Thank you so much.
Okay, so let's get into this topic.
Okay.
What is weight loss surgery?
Well, weight loss surgery are basically surgical procedures done for individuals who are morbidly obese to achieve weight control and also get rid of excess body fat.
Fantastic. Okay. Is it everyone that can, who is maybe overweight or obese that can have, undergo weight loss surgery?
No, it's not for everyone. An individual has to be eligible for weight loss surgery.
So there is an eligibility?
Yes, there is.
Please let us know.
Okay. We normally use the individual's body mass index, BMI, to determine eligibility to some extent.
Okay.
Body mass index is basically a ratio of the individual's weight in kilogram and the individual's height in meter squared.
Okay.
So normal body mass index for every normal range for body mass index is 18.5 to 24.9.
Okay.
Individuals with 25 to 29.9 are said to be overweight. Okay. BMI of 30 and above, the person is said to be obese.
All right.
So when the body mass index is 30 to 34.9, we say it is class 1 obesity. When it is 35 to 39.9, we say class 2 obesity. Okay. When it is 40 and above, we say it is morbid obesity or class 3 obesity. Okay. To be eligible for bariatric surgery, your BMI has to be greater than or equal to 40. That is, you have to be morbidly obese.
What are the different types of weight loss surgeries?
Okay. They can be broadly classified into 3 different types, and this is based on the way they work. We have the restrictive types. The restrictive type, what they do is just to limit the amount of food that the individual eats. Okay. Example of restrictive types are the adjustable gastric bands. Okay. We'll get back to that.
The pictures are coming up.
Yeah, adjustable gastric bands and the sleeve gastrectomy. They are restrictive. They basically limit. They reduce the size of the stomach. Okay. Therefore, limiting the amount of food one will eat to be satisfied, and also that would have an effect on the weight or the weight loss. Okay. The other type is the malabsorptive type, meaning when an individual eats, the way they work is they affect the absorption, digestion and absorption of these food calories. Instead of being absorbed by the body and being stored as fat, they are excreted in feces. So it doesn't stay in the body. And the third class are those that combine these two. Those are both restrictive and malabsorptive. Now, the 3 different broad classification of bariatric surgery.
Okay, so who makes this decision as to what type of surgery an individual should have? Is it something a patient can decide, or is it something that the surgeon decides as a result of the condition that patient presents?
Okay. Bariatric surgery is a multidisciplinary work. It involves different teams. Okay. It involves the surgeon, the nurses, the nutritionist, the psychiatrist, the anesthetist. Many people are involved with the patient. So it's not just one person that decides. We'll look what is best for this patient based on the patient's maybe the criteria which people are eligible for, the patient's age also, the risk associated with it for the particular individual. So it's not just a rule, this is what you will do for this patient. No, it's tailored to the patient, to that particular patient, that particular individual, what will work for him or her.
Okay, so for someone who, for one reason or the other, neglects these instructions, what can happen?
Person can come back to where they started from. The weight gain, again, especially when...
Even when the stomach has been cut off? Or?
The stomach can expand gradually, a little bit, gradually. They have to follow the dietary advice regularly. And because of the attendant complications, it's better you do your follow-up regularly. The dumping syndrome, how to manage it properly, what kind of meals to take. Sometimes you have to take liquid diets, to ensure that, all the symptoms that comes with it are well managed and all that. So you have to if follow-up is missed, there are adverse effects to that. The weight loss can go back. Person with the lap band doesn't come for regular follow-ups for adjusting the belt can loosen, and he thinks there's something there restricting his stomach. There's nothing.
People out there who have this particular condition and you know that your BMI is above 30 or above 40, you can go to your physician and ask them what your options are. They will do a thorough checkup on you and they'll be able to advise you on which one will be the best action for you to take. So till we come your way next time on Weight Matters, do have a wonderful week. Thank you.